In the basics lecture, we talked about benign tumors and malignant tumors. So I'm going to go into a little more detail of how you classify benign versus malignant, what's the difference between the two, and how tumors are staged. So you'll hear people say they have been diagnosed with stage 4 colon cancer or stage 4 breast cancer, or stage 1 or stage 2. We'll talk about staging of tumors. So for the learning objectives for this section, distinguishing between benign and malignant tumors and how malignant tumors spread by invasion, metastasis, and seeding, and relating them to the staging of cancer. That's one of the ways they stage is by whether or not it's metastasized, how many nodes there are. So first, a little bit of nomenclature. Benign tumors usually have a tissue name plus the suffix oma. So an adenoma, it's an adrenal gland, it's a gland with a tumor. It's a gland tumor. It's an adenoma. And adenomas are one of the most common types of benign tumors. Malignant tumors have the name of the tissue plus the suffix carcinoma. So if you have a malignant gland tumor, it's an adenocarcinoma. So an adenoma is a benign gland tumor, and an adenocarcinoma is a malignant gland tumor. So tumors of connective tissue are usually termed sarcomas and are often malignant. You know, they have connective tissue throughout your body, so malignant tumors spread. That's one of the things about malignant. There are several malignant tumors that have unique names, such as Hodgkin's disease, Wilms tumor, and leukemia, and we will talk about those a little bit this quarter, and then when we talk about the blood and lymph systems next quarter, we'll talk a little bit more detail on those. So benign versus malignant. How do we tell them apart? Benign tumors are usually differentiated cells that reproduce at a higher rate than normal. So remember we said those dysplastic cells are or anaplastic cells are undifferentiated and they're just producing out of control. So with benign tumors, they're producing at a higher rate than normal, but not necessarily out of control the way a malignant tumor is. Benign tumors tend to be encapsulated. So you get an encapsulated, slowly expanding mass. The tissue damage that happens from benign tumors is a result of compression of adjacent structures. If you have that in the brain, it can be life-threatening, or if it obstructs a duct or some kind of opening, a benign tumor can be life-threatening. Other than those two situations, though, benign tumors are usually not life-threatening. Malignant tumors, on the other hand, are often dysplastic or anaplastic, so undifferentiated, non-functional cells. They they reproduce rapidly and have abnormal mitotic figures, so they're the weird ones. They're the ones you look under the microscope and you say, "Whoa, what is that?" That's not right. And they infiltrate or spread into the surrounding tissue, and they often spread to distant sites, and that's called metastasis when they do that. So this is a graphic from the book where they show the encapsulated, slowly expanding mass with relatively normal cells, just reproducing at a higher rate than normal. The malignant tumor, you have irregular shape and surface with abnormal, irregular sized cells, and you also get invasion of blood vessels. The abnormal cells invade blood vessels, and that's one of the ways they metastasize. So you can have local or systemic effects from tumors. Pain can be a local effect if it's compressing something that's going to cause pain, but pain may be absent until the very late stages. So a lot of times, things like digestive system cancers and areas where we don't have a lot of pain sensory nerves, people don't have pain until very late stages, and the pain only occurs when the tumor is well advanced. The severity of the pain is going to depend on the type of tumor and the location of it. Obstruction occurs when the tumor compresses. I'm missing an H there, I see. The tumor compresses a duct or passageway, or the blood supply or lymphatic flow is restricted. You can have an obstruction in the digestive tract. You could have an obstruction of the airflow in bronchi. So those are all issues, but it's a local effect. It's not a systemic effect. And then tissue necrosis and ulceration from pressing on the surrounding tissues, so the surrounding tissues may lead to bleeding or infection around the tumor. And so remember, one of the warning signs of cancer was unexplained, unusual bleeding. This could be the reason. So malignant tumors are scary. They lack control of mitosis. They don't undergo apoptosis. So you're creating a bunch of cells and you're not destroying any cells. And there's no normal organization or differentiation. So you have non-functional cells. You have non-functional tissues. And that's a problem. And they're also taking nutrients from functional cells. There's no contact inhibition. There's usually our cells, like your liver, doesn't normally grow into other areas of your body. There's contact inhibition for other areas, but malignant tumors, the cells go, nope, I'm going anywhere I want. You have abnormal cell membranes. You have altered surface antigens, so the body recognizes them differently. And the cells don't adhere to each other, so a cell can break loose from the mass and go off and invade other tissues and spread to distant sites. So that's a big problem because now you have another tumor, you have abnormal cells in other areas of your body. So malignant tumors can, the mass of the tumor can compress blood vessels, just like with benign tumors. And when blood vessels are compressed, it leads to necrosis and inflammation around the tumor. And tumor cells may secrete enzymes or hormones that break down proteins in cells or cause systemic effects like altered calcium levels. So one of the effects of that, and we'll talk about it in the next section, is called paraneoplastic syndrome, where the tumor cells are secreting enzymes or hormones and making it look like you have some other condition in your body. It usually delays diagnosis because they're trying to figure out what's causing this, and the clues are pointing to something else besides a tumor. You get inflammation in the area and loss of normal cells, which leads to progressive reduction in organ integrity and function. So now the malignant tumor is not just causing local issues, it's causing problems with organ systems and function. And you also get angiogenesis, which is where some tumor cells secrete growth factors that stimulate the development of new capillaries in the tumor because it's hogging all the nutrients in the area, and it needs blood vessels to bring it more nutrients. So malignant tumors are sneaky, and they're gonna take you down if you're not careful. They also can spread. So they can spread by invasion, where it's local spread, they invade the local area. The tumor cells grow into adjacent tissues. So the example that's given in the book is uterine carcinoma invading the vagina, or breast cancer cells invading nearby lymph nodes. Metastasis is where the tumor or the abnormal cells spread to distant sites, usually via the blood or lymph or other body fluids. So the example is the carcinoma of the colon spreading to the liver via the bloodstream. So that's never good. So there are two ways that cancers are classified. The primary site where the cancer first develops. So when you say someone has colon cancer or breast cancer or pancreatic cancer, that's the primary site where the cancer first developed. And then it's classified histologically by the type of tissue in which the cancer originated. So many different types of cancer, but there are just 6 categories of them. So these are the 6 categories. So the International Classification for Diseases for Oncology defines 6 major categories: carcinoma, sarcoma, myeloma, leukemia, lymphoma, and mixed. Mixed is the miscellaneous category, I guess. So carcinoma is a malignant tumor that arises from epithelial tissue such as the skin, the linings of internal organs, and accounts for 80 to 90% of all cancers. There are two major subtypes of carcinoma: adenocarcinoma, which develops in an organ or gland such as lung, prostate, breast, or colon. And adenocarcinomas are the most common type of carcinomas. Squamous cell carcinoma develops in the squamous epithelium. Skin is the most common for squamous cell carcinomas, but also digestive and respiratory tracts in certain organs. So sarcomas arise from connective tissues or other non-epithelial tissues such as muscle, fat, nerves, and bones, and they account for about 1% of adult solid cancers, but over 20% of all pediatric solid cancers. So that's kind of interesting. There are more than 50 types of sarcomas, typically grouped into two main kinds: bone sarcoma, which is called an osteosarcoma, or soft tissue sarcoma, which is the most common type, but still overall not as common as carcinomas. Myelomas are plasma cell neoplasms arising from plasma cells of the bone marrow and are estimated at 1.8% of all new cancers. So you can have multiple myeloma, which is the most common, found multiple places in the body, or a plastocytoma, which is a single mass. The interesting thing about when you look at all these, all the classifications, 80 to 90% are the carcinomas. Those are the ones we think about a lot. And so I'm going down in percentage in categories. So when somebody has a multiple myeloma, that's pretty uncommon. Leukemia, emia is blood, right? So it starts in the early blood-forming cells found in bone marrow, most frequently of the white blood cells. When we talk about next quarter, when we talk about blood and lymph, we'll talk about the classifications of leukemia. But leukemia is the most common cancer in children and teens, and it's estimated 3.7% of all new cancer cases. So leukemia can start suddenly, which is acute leukemia, or progress slowly, which is chronic leukemia. And the type of leukemia is based on the cells involved. And we will talk way more about these in the blood and lymph chapter, which we'll do at the beginning of fall quarter. So you'll have like acute myelogenous leukemia, AML, which is acute leukemia of the white blood cells, or acute lymphocytic leukemia, ALL, or chronic, CML or CLL. So we'll talk more about those next quarter. So that's just an intro. I'm just giving you the seeds, and we'll let them bloom next quarter. So lymphoma arises from lymphocytes in the glands or lymph nodes, or in lymph vessels, lymph nodes, spleen, tonsils, or the thymus. There are dozens of subtypes of lymphoma that fall within two categories based on histology, which is cell identification. So Hodgkin's lymphoma, which is estimated 0.5% of all new cancers, and non-Hodgkin's lymphoma, which is estimated 4.3% of all new cancers. And we will talk more about those in the lymph chapter as well. Sometimes cancers have more than one histological type, and therefore they're considered to be mixed. So examples of mixed types are like an adenosquamous carcinoma, a carcinosarcoma, or gastric mixed type carcinoma. So just some categories. So mixed type just means there's more than one tissue type involved. Cancers are staged to explain the extent of the disease. The staging process, it usually starts at diagnosis, and it doesn't change over time, even if the tumor shrinks or the disease progresses. So if you get diagnosed with stage 4 cancer, they don't back it off and say, oh, now you're down to stage 1. And so the classification that you start with is the classification that you stick with. And so first of all, they group them as solid tumors or liquid tumors. So solid tumors are in a tissue like epithelial tissue, connective tissue, solid tumors. Liquid tumors are blood cancers or hematologic malignancies like lymphomas. So solid tumors, liquid tumors. Solid tumors use the TMN classification. That's the most widely used system for staging solid tumors. And the system was developed by the American Joint Committee on Cancer and the Union for International Cancer Control. So the T stands for primary tumor. So if you say you have breast cancer, that's where the primary tumor is. N is regional lymph nodes, and M is distant metastasis. So the combination of ratings for TMN plus the stage grouping, and then there are different staging systems for brain, spinal cord tumors, and liquid tumors. So stage 0 is a carcinoma in situ. So there are abnormal cells. There's no cancer, but the cells could become cancerous. So the stage 0, that's considered you have precancerous cells. Stage 1 is an early stage, so no cancer cells were identified in regional lymph nodes and no metastasis. So you have cancer cells, but it's not spreading. Stages 2 and 3, the cancer cells are still localized, but they're starting to invade nearby tissues and structures. And there's subdivisions like 2A, 2B, and I don't know exactly where they draw the line on those, but just to know that sometimes you'll see those. And stage 4 means you've had metastasis. So you'll get, when you get cancer staging, they'll say if you have stage 4 breast cancer, it means it originated in the breast, it has invaded regional lymph nodes, and you do have distant metastases. And that's what makes it stage 4. If you have a tumor that is only in the early stage and there's no regional lymph nodes invaded and no metastatic disease, that's stage 1. If you have invasion but no metastasis, that's the stages 2 and 3. So hopefully that makes sense. And that's what you usually hear for solid tumors. For liquid tumors, they have different things. There's not a standard method like the TNM like there is for solid tumors. So usually leukemia has its different categories, which we'll talk about next quarter. And then they talk about just the histological classification. So it's a lymphoma or a myeloma or a leukemia. So references for you to look up if you would like to. And then in the next section, we'll talk about the diagnosis and treatment.